everyone, I'm Brittany, the host of the Shed podcast and also a health coach here at Shed. One of the most common and completely valid fears we hear from members is this: will I gain all the weight back once I stop taking a GLP-1 medication? And it makes sense, right? After working so hard and finally feeling like yourself again, the idea of going backwards can be really scary. So today I'm sitting down with Dr. Niazi, an internal medicine physician, to talk about that fear, what the science says, and most importantly, how to approach GLP-1 medications the right way so you're not just losing the weight, but you're also keeping it off for good. Dr. Niazi, welcome to the show. We're so happy to have you here.
Really appreciate it, Brittany. Thank you so much for having me. Thank you.
Of course. Well, let's go ahead and dive in. I want to kind of start with the big question that is on everyone's mind, right? In your experience working specifically with GLP-1 medication users, is it possible to keep the weight off after stopping a GLP-1 medication? Have you seen patients be able to keep the weight off?
Absolutely. That's a great question. It's probably the most common question that I get asked, which is actually a good thing, which means patients are reaching their goal weight. But yes, to answer your question, absolutely, Brittany, patients can keep the weight off. What's very important is that they're under the guise of a physician or a nurse practitioner to help guide them through that process and make sure that they taper off the medication appropriately. A lot of the horror stories that you'll see or read about generally tend to happen when patients are taking a large dose of a GLP-1, especially over an extended period of time, and they stop suddenly. So it's very important from a physician standpoint, from a medical standpoint, to really taper the patients off gradually off the medication and sort of guide them. There are also other tricks as well beyond just the dose adjustments themselves to make sure that patients are able to maintain and keep the weight off as well. But yes.
Chronological aging might be inevitable, but feeling and looking old doesn't have to be. Shed's NAD+, which is often referred to as the fountain of youth, works at a cellular level to help slow the signs of aging from the inside out, repairing DNA, regenerating cells, and revitalizing your metabolism. Feel and look energized, vibrant, and youthful again. Try Shed's NAD+, and get 10% off with the code POD10, POD10. So it really has a lot to do with the dosage and kind of how people are taking the medication. You mentioned there's other things as well. I would love to know, what are kind of the tips and the tricks that you tell people when maybe starting a medication or somewhere along their journeys? Like, what other things should they be keeping in mind to be able to set themselves up for success post-medication?
Great point. So this is something I mentioned to everybody, that a GLP-1 is not a magic wand. It's a phenomenal medication, has a lot of great benefits, but it's not going to solve all of your problems for me from a weight loss perspective. It's just a boost in the right direction. I view GLP-1s as training wheels on a bicycle, if you will. It's essentially supposed to help you get to the right point, but essentially once we can take those training wheels off, what's more important than that is your diet and also your exercise. Diet is critical here. So one of the things I emphasize to every new GLP-1 patient is making sure that they're eating a high protein diet that's also high fibers, low fats, and low carbs, but ideally eating small meals that are staggered and spread out throughout the day. This is really the best way to avoid side effects with the GLP-1 while also keeping your metabolism up. In addition to this, making sure that you're drinking enough water as well, so that sensation of your fullness or satiety is still there, even if the dose of the medication is going down. And so 64 ounces a day is generally the minimum that I recommend to patients on a GLP-1. That's about 8 glasses a day, give or take. Beyond just that, just making sure that you're exercising as well. And one of the things I emphasize is resistance training, making sure that you're actually going to the gym to perform weighted exercises, whether it's with machines or with free weights as well. But this is all a holistic picture. One of the reasons I love Shed, especially for me as a doctor, is knowing that there's a holistic coaching side team available as well. So thank you so much, Brittany, and to all the coaching individuals here at Shed, because that's important, very, very important. It's not just enough for me as a doctor to prescribe the medication, but making sure the diet aspect is nailed in along with the exercise as well is critical.
Absolutely. I think describing it as like a bike with training wheels, or sometimes I even like to describe it as this tool that kind of helps raise the ceiling so that this lifestyle change, this behavior change that so many people want to make and they know they should make, right? But it can be really difficult to make. And so using the GLP-1 medication as almost this thing that lifts that ceiling just a little bit higher so people can actually implement that behavior change is amazing, and it's life changing for
Absolutely.
a lot of people.
Yeah. The main thing I just wanted to add to that great point you made, Brittany, is the concept of food noise. That's essentially what's going on with the GLP-1. We're decreasing your food noise or your desire or ability to want to eat food throughout the day. And it's something we all suffer from. And so with the GLP-1, that's a lot more under control. And I stress this to patients because I get patients sometimes telling me, Dr. Niazi, I'm not losing weight. But I always ask them this question: do you feel like the food noise has went down? And a lot of times the answer is yes. And in those cases, we typically keep the dose where it's at. And I sort of reassure the patient that they just need to be a little bit more patient. And I'll just add one last point to that, that losing too much weight quickly is not generally a good thing either. You want to be losing anywhere between 3 to 6 pounds generally a month. Any more than that generally means that you're losing muscle and not fat, because muscle is more dense than fat. So it's just some important facts.
Yeah, so many nuances to taking a GLP-1 medication. And I think people have this idea that it's going to work instantly and be this quick fix where they're going to, in a month be down to their goal weight. And, here at Shed, we really prioritize losing weight in a healthy and sustainable way, right? And healthy being making sure we're losing that, 3 to 6 pounds that you said per month, so that we're not losing it, too quick and having other kind of consequences come along with that. But also the sustainable aspect, right? So making sure that we are supporting our patients with health coaching to be able to set themselves up for really great success. And it takes time, right? To your point, like it really is a process. And sometimes that first layer can just be getting rid of the food noise, right? And so maybe we're not even seeing any change on the scale while your body adapts to the medication, or while your brain is kind of shutting down that food noise. And so we often refer to those things as like non-scale wins. And as health coaches, how can we really help a client focus on those non-scale wins? Because it's not all about the scale. And I've had so many patients who are like, the food noise reduction alone is like the best piece of this whole experience, right? And of course, the scale going down is just like icing on the cake, but that food noise is a huge piece.
Absolutely, Brittany. I agree with you, though. I think what you just said, you nailed it on the head with the control aspect, is giving the control back to the patients. That's probably the most satisfying thing for me as a physician, is seeing patients tell me, doctor, I not only have the confidence back with my physical body and my appearance overall, but also I feel like I'm in control. I get to choose what I want to eat rather than my food controlling me, which is a phenomenal thing to hear. And you're absolutely right. It's a slow process, but the whole idea is that we're really rewiring the brain chemistry. We're rewiring how your body interprets food, how it gets full. So it really does take time.
Yeah. Um, Speaking of sustainability of it all, I know, and I'm excited to get a little education on this as well, but I do know that there is a natural hormone that our body produces called GLP-1 hormone.
Yes.
And so I would love to hear from your perspective and kind of learn a little bit of the science behind what is a GLP-1 medication doing to help kind of maybe boost that GLP-1 hormone, and how does that play a role in someone who is taking a GLP-1 medication and then coming off of a GLP-1 medication? What role does that kind of play in maintaining the weight loss?
Absolutely. And there's so much stuff we're even finding out now about what a GLP-1 does. But yes, a GLP-1, or glucagon like peptide 1, it's a mouthful, I know, is essentially a receptor that all humans have, which is important as well. A lot of patients think that we're adding something exogenous or something that's not already naturally present in our body. But GLP-1 is a natural peptide. So it's a protein molecule that's already found in our body. It's essentially what it does is it helps to go to the GLP-1 receptor sites themselves, and it helps to keep them full. And when they're full, your body receives a signal to the brain telling it that it's gotten enough food, and so it doesn't need to eat more throughout the day. The other aspect of a GLP-1 that's important has to do with the releasing of insulin, specifically from the pancreas. So obviously, when you eat food, if you're not on a GLP-1, what you can end up with is a massive spike of insulin, and that's not generally a good thing. Being in a hyperinsulinemic state, as we call it in the field, is not a good thing because that can lead to something called insulin resistance, which is the definition for type 2 diabetes, which is a problem where your receptors just aren't responding to the insulin that's in the blood because they're constantly high. And this helps to sort of almost dose that micro, like a very small amount throughout the day so it's more balanced. And so it's important on that regard. Beyond just that, now we're finding out studies that GLP-1s are even neuroprotective. So patients, for example, are able to decrease the risk of dementia. There was a study that came out recently. It was about 7,000 patients or so where they actually decreased the risk of dementia by over half. The patients that have Parkinson's disease, for example, as well. There's been studies to indicate that even patients with Parkinson's disease, there's a less chance of developing that. And patients that already have Parkinson's, their symptoms have decreased while being on a GLP-1. Beyond just that, it's also anti-inflammatory. So your GLP-1 receptor, we're finding out now, has actually inflammatory properties as well. So by having the GLP-1 exogenously in there, it can be anti-inflammatory. So a lot of my patients that suffer from autoimmune conditions like rheumatoid arthritis or psoriasis, those patients actually tell me that they're doing a lot better. Or patients that just have any sort of joint pains as well, they're also telling me that their joint pain has been resolved. So the GLP-1 molecule, very interesting. It really does a lot of things. Yeah.
Do you struggle to drink chalky protein drinks just to hit your protein goals? Shed's Clear Protein Plus Hydration is here to change that. With 15 grams of high-quality protein plus electrolytes for hydration, which is another must on your weight loss journey, it has this light, refreshing consistency of an electrolyte drink, no chalkiness, no heaviness. Simple, clean ingredients, delicious flavors, and perfect for your weight loss journey this summer. Try Clear Protein Plus Hydration with 10% off using code POD10, POD10. Yeah, it is interesting how many buckets it kind of taps into. And so, whenever people get on this medication for maybe just weight loss, they often see a bunch of other things. Like, I have a member who was struggling kind of controlling the amount of alcohol he was drinking, and he wanted to make a change. And he didn't even go into the process wanting to make a change to his alcohol consumption. He had maybe just mentioned it in some of our intake. And sure enough, a couple weeks in, he was like, I haven't even had the urge to crack open a beer or have a drink of alcohol. And his alcohol consumption had really gone down. And so something I think in terms of sustainability from a health coach perspective is like, going back to what we were talking about earlier, this medication is a tool to lift that ceiling, or it's the training wheels to make some of these changes. And even things like reducing alcohol consumption or being more mindful of portions, or, all of these different things, eating a more anti-inflammatory diet for people with rheumatoid arthritis or fibromyalgia or those sorts of diseases. You get to kind of build this skill set that you will be able to take for the rest of your life, right? Like, that's the beauty of this being a longer process, is you get to use those 6 months, 1 year, 2 years, however long you end up being on this medication. You get to use that time to really build this skill set and make this toolbox almost, so that you can go off and, maintain some of these things that came along with it. So yeah, I think it's so cool how that GLP-1 hormone has an effect on so many different aspects that all really do come back to inflammation and weight loss and, those overall things. But I think the journey, it's sometimes fun to see what else you kind of uncover with this medication.
Absolutely, Brittany. And you brought up two interesting points about the alcohol. And I would also mention opioid as well. I've had a lot of patients that suffered from a heavy intoxication, either in the past with alcohol or opioids. And that has to do with the dopaminergic reward center of GLP-1s and how it affects that. And so it helps to essentially stabilize it, kind of like how it does with the insulin levels as well. So I have a lot of patients that were doing significant significant more alcohol prior to starting on a GLP-1, and they were doing much less. And that also has to do with the side effect profile as well. As any patient comes in for a GLP-1 consultation, and if we deem them a patient to be started on a GLP-1, I always caution them to be careful about alcohol. You can still have a shot here and there, is what I tell patients, but you really want to avoid heavy alcohol drinking because alcohol works synergistically with the GLP-1 to slow down gastric emptying, which is how these medications work. They slow down gastric emptying, they keep food in your stomach for a longer period of time, and they allow you to get full faster and stay full longer. But by doing that with alcohol, you're sort of adding a synergistic effect. But yes, again, going back to my earlier point about control, it's been phenomenal seeing patients have that control back in their life.
Yeah. And so I guess like my question there is someone who has reduced their alcohol consumption, someone has who has reduced their portion sizes, someone who has maybe made changes to their diet or exercise. What would you tell them if they are concerned that once they get off of a GLP-1 medication that all of their old habits are going to come back? You know, they're going to start drinking as much as they were before. They're going to start eating kind of crappy like they were before.
Yeah.
What would be your advice to them?
I think the biggest thing is that slow taper. Just the same way that we tapered you onto a certain dose where we reached your goal weight is the same way that I, as a physician, would slowly taper you off. And there's no like one size fits all approach. Every patient is different. Some patients need more time at a specific dose. So the idea is that we're slowly tapering you off so that your receptors for the GLP-1 are able to be sort of satiated throughout the process. So your body is able to produce its own natural GLP-1 slowly as we take you off the medication. Most of the issues, again, as I've ever seen, have been sudden, abrupt stops, whether a patient lost their insurance coverage, maybe switching from a job. And those are the stories that I'll hear where patient will tell me they gained all the weight back and now they're coming back. But generally speaking, patients that are slowly tapered off don't suffer from that. The other concept that I wanted to bring up was microdosing, which has become a really hot topic right now for physicians, which you might have heard. I think when I first heard about this, it was something I was against. I was like, this is not something that I could see someone being on long term, but there's a lot of studies and research that's come out to support the fact that microdosing definitely works. And what that really entails is a very small dose, the smallest applicable dose needed for a GLP-1, and essentially being given to a patient. That sort of is a maintenance sort of phase, sort of long term, maybe 6 months to a year out. And essentially, the idea is that that's more for like non-weight loss related benefits. So, to your point about alcohol reduction, opioid withdrawal patients, patients looking for anti-inflammatory benefits, and most importantly, the neurocognitive benefits as well. So, for those patients, that really is a wonderful option. So, don't think that once you reach your goal weight, we have to stop you abruptly and that you're going to gain all those bad habits back. It's a slow, gradual process, essentially. Yeah.
Yeah. Yeah. Once my members get to like that 5 to 10 pound range before they hit their weight loss goal, that's when I usually recommend, hey, you know, it's time to probably schedule an appointment with a provider and kind of talk about and make a plan with your provider about like what that tapering off looks like and that sort of thing. So yeah, I think it is important to know that once you reach that goal weight, there is still that kind of maintenance phase that needs to be done properly and correctly in order for you to be able to, you know, your body adjust to getting off of the medication. I think from like a diet standpoint too, we do reverse dieting as well. So that's really something that we as health coaches, that's our kind of maintenance phase for our patients. Um, yeah, yeah. So, you know, kind of just working with the science that we have, both providers and us as health coaches on the like nutrition and exercise aspect and behavior change aspect, working with those two people to make sure that that plan is really solid. And sometimes it's just that confidence boost too, right? Like I have patients who are starting to taper off and they're so surprised. They thought everything was going to come back. They thought their bad habits were going to come back and they're often so surprised. Yeah, because they went about it the correct way. So I think that really is so important from both the lifestyle change and the medication standpoint. So give us a little bit of insight into, because I'm sure you've seen it all with GLP-1 medication users. And so there's probably a bucket of people who have kept the weight off post medication. Obviously, they had great success. They met their goal weight within the program and then have now continued to keep that weight off. There's also the bucket where, unfortunately, maybe they reached their goal weight but have not been able to keep that weight off post medication. Can you give us insight into what is the patient in each bucket doing that kind of differentiates the two?
Yeah, a great question, by the way. I think in the bucket that actually manages to keep the weight off long term, or if at worst gains a little bit back, they're just doing lifestyle modifications in addition to this, the GLP-1, all throughout the process. To your point, why it's so important to have close follow up with patients. Why I always try to keep all my follow ups within a 2 month time span, just so I'm able to check in and reinforce those lifestyle modifications. It's a lot of times it isn't even about the dose adjustment per se. I just want to check in with the patient and make sure that they're eating the right foods, that they haven't had any side effects, that they're exercising at the gym. That's what the bucket of people that actually manages to keep the weight off are doing generally, even after we have decreased the medication to a micro dose, or in some cases even stop the medication. In some other instances, I've seen them use our GLP-1 boost or revive products as well, which has been phenomenal. Those are natural ingredients that function in a very similar way to how the GLP-1s work, by slowing down gastric emptying and keeping that food in your stomach for a longer period of time. The bucket of patients that generally don't do well are sort of viewing GLP-1s as a quick fix. And I'll caution against this, and I'll try to screen for this, from an early standpoint. Or it's also patients that just don't have the financial means. I'll see patients occasionally that try to come on for maybe a month or two, and I will really caution against that, where patients generally think that they can take a GLP-1 for a very short interval and just sort of they can reach their goal weight and just stop it altogether. That's not how this medication unfortunately works. It works, but in a long-term fashion. Essentially, what we're doing here is rewiring the brain on how it interprets food and how it consumes calories. Those are the two things that I stress to patients. And so it's not so much as a medication designed to lose weight, but more to rewire the brain. And so, and in addition to that, they're just not doing more of the lifestyle modification things that I mentioned earlier. They're usually not exercising as frequently as they should, or they're just doing cardio only without any resistance training as well. So those are all concerns. Yeah.
Yeah, I love that you mentioned you kind of screen for that, from the provider side, because I often hear, and I don't know if you've heard this before, but I often hear patients say, I just want to get to X weight before I start making lifestyle modifications. And yeah, as a health coach, and I'm sure you can relate to this, lifestyle modifications, they take time, right? Thinking about changing your nutrition completely for most people is a process that takes time. It's intimidating, and it does take a little bit of like, okay, let's try this out. This isn't working. Why isn't it working out? And then we take feedback from that. So, yeah, to your point, it's awesome that here at Shed we have both providers and health coaches really screening to make sure that we're setting our patients up for the best experience, to make sure we're setting them up for success even after they stop working with us, right? Like post medication as well. So I think that's so important.
Absolutely. No, it's very important. The biggest thing for me at Shed, the reason I joined this company, was that it's very holistic an approach. We don't just prescribe patients medication haphazardly. I really want there to be a holistic sort of backbone where we're reinforcing the ideas of dieting and exercise, and reinforcing that this is a process and that the medication is more just a boost in the right direction, if you will. So absolutely.
Yep, absolutely. And as you mentioned, boost, I know you had mentioned GLP-1 boost, and that's the other thing that I often kind of inform patients about when they get to that 5 to 10 pound mark until they reach their goal is, hey, talk to a provider, of course, kind of get a plan going with them as far as the medication. I'll take care of you, continue to take care of you in terms of lifestyle change. But something that does make people feel good kind of going off of the medication is having that like training wheel still of the natural GLP-1 boost, getting a little bit of that boost in that GLP-1 hormone from the supplement perspective. So yeah,
Absolutely.
I
No,
think that's
I
really,
was going
really
to add to that.
important.
I would 100% agree with you, Brittany. I was just going to add to that and say that I, as a provider, always have a checklist in mind whenever a patient's sort of about to stop taking the medication. I just make sure that we have a proper plan in place, for example, with either a GLP-1 boost or in some cases even switching to an oral option for some patients, which is easier because it's usually less potent than, for example, taking the injections once a week. And so those are all things I'm thinking about. And then also making sure that if they really are going to stop the medication, that this is a patient that has those lifestyle modifications in place. Because if it's somebody that even has sort of gradually tapered off the medication but doesn't have the lifestyle modifications backbone there to help them, then they can also run into that issue of regaining the weight back.
Yeah. And I think that in itself is something that really sets our providers apart is we want to make sure that we're personalizing this journey, right? Like you mentioned earlier, it's not a one size fits all. And so how can we really look at this one patient and say what is going to be the best situation for them and how can we best set them up for success? So I love that personalization piece. That's super cool. Okay, so I think I would love to know, hold on one sec, sorry. I lost my place. I think we've honestly covered most of it. Oh, okay, I do want to ask that question, and then I might have like maybe two more questions left. Let's see. Okay, perfect. Two more. I have one more question, and then we'll finish with like a closeout question. Okay. So a GLP-1 medication is very helpful for people who have PCOS. I have heard tons of stories of, women with PCOS who this medication has been life-changing for them. I also work with a huge majority of my patients are menopausal women or premenopausal women. And so I want to know for those patients, in terms of sustainability of this medication, how does that kind of work, right? Because I guess my question is, does your hormones kind of change as you're on this medication and you can eventually come off of it? Or is it something that is more long-term for people who are struggling with, PCOS or hormonal fluctuations with menopause?
Yes. So I think that's a wonderful question. This is probably my favorite topic, if I'm going to be honest. I've done a seminar actually with the fertility clinic, and it's so fascinating how GLP-1s have changed the game. What started off as a medication for diabetes, then became a weight loss medication. Now it's being used to treat so many other things. But with PCOS, or polycystic ovarian syndrome, the changes on patients' life has been absolutely phenomenal. I have so many patients that are able to conceive for the first time, and I was mentioning this in an earlier podcast that I did, that it's actually it's one of the rare occasions where I'm happy as a doctor to remove a patient off of a GLP-1 because they become pregnant for the first time, or they'll tell me that they're going to conceive within the next 3 weeks and that they're having regular periods. And the whole theory behind this is that the hallmark issue in PCOS is insulin resistance. So it's kind of similar to type 2 diabetes. We used to actually treat PCOS with a medication called metformin, which was the standard of care. But with metformin, it's not only is it very weak, but it comes with a lot of GI side effects. It's nowhere near as potent as a GLP-1. It works a lot more slowly and more as an add-on therapy. With the GLP-1, the effects are much more drastic. Not only do they gain their confidence back, their periods become regular, and at the same time, they're losing weight. And with weight, it's really a double-edged sword because the other issue with PCOS becomes the estrogen as well, because fat is actually an organ that produces estrogen. So as you can imagine, you're in a catch-22 cycle because not only do you have more fat, but you also have more insulin being released throughout the body when you suffer from PCOS. So this GLP-1 kills two birds with one stone, if you will. So it's a phenomenal medication for patients in that regard. And then with perimenopausal patients, it's also kind of similar. It's not so much as much with the insulin resistance, but more on the estrogen aspect, where the estrogen levels can be a little bit imbalanced. And as I'm sure you know, you gain more weight with that. And again, fat produces estrogen, so you're increasing the amount of estrogen throughout the body, and this can cause issues with hot flashes, for example, that patients can experience, or just mood swings, etc. And so a lot of my patients have found wonderful effects with the GLP-1, and these are patients that usually are able to lose weight, but they can't keep it off. They'll always tell me this, and finally with the GLP-1, they're able to keep the weight off. And to answer your question, generally speaking, PCOS patients and menopausal patients are the patients that I like to keep on that micro microdose option, because again, it's never going to truly fix the actual issue per se, because the actual anatomical physiological issue is still there, with PCOS being the excess amount of cysts in the ovaries that are releasing the higher amounts of the insulin slash testosterone, and so that really becomes the issue there. And obviously with menopausal, that's more an age related thing. And so with this, you generally want to still keep the patients on a small microdose of the medication. But I will say I've seen patients where we have them on for a few months, we get them to their goal weight, we slowly taper them off, and they're able to conceive from there. So it does work from that aspect as well.
Okay, yeah, good to know. And I can see where that microdose would be helpful for people who maybe haven't, there's a deeper rooted problem that, might not ever go away necessarily, or for a good period of time, like people in menopause, it might not go away for that period
Exactly.
of time. And something too to kind of piggyback off of that is oftentimes whenever it's difficult to lose weight, or maybe you've tried to lose weight and you lose it for a short amount of time and then you gain it all back, it's easy to use, okay, I'm going through menopause or I have PCOS, and so that is the sole reason why I'm not able to lose weight. But as a health coach, sometimes, yes, that is the overarching issue and the overarching challenge that people are experiencing. But as we get into looking into diet, maybe they've been too extreme with dieting in the past, and that's
Yes.
why the weight hasn't kept off. Or maybe they think that their nutrition habits are good when really they're not getting balanced and complete nutrition. Or, maybe they are doing, a little bit of exercise but could make some room for improvement. Maybe their sleep isn't, that great, causing hormonal fluctuations too, or stress management. That food noise could be an aspect too. So I think it is really cool to see this GLP-1 medication help so much with some of those actual root causes, but then to also be able to have this kind of complete experience with Shed, working with a health coach to also look at what else could I be doing in terms of lifestyle changes and that sort of thing, to make sure I'm setting myself up for the best success getting off of this medication, or potentially even getting onto like a microdose medication, while also forming some really good habits to just kind of contribute to that overall health. So yeah, that's super cool to hear, and super interesting. I always wondered that.
Absolutely agree with you. No, for sure. And again, I just want to stress the fact that every patient is different. I treat every patient unique, because everyone has their own goal weight, their own starting weight. Everyone has their own chronic medical issues. And so there's no one size fits all. Every plan is designed to be tailor made for a patient's need.
Yeah,
Absolutely.
awesome. So last question for you, Dr. Niazi. If someone is listening right now and is nearing the end of their weight loss journey, right, get into that like last 5 pounds, which is so exciting, they might be getting nervous about the future. What is one piece of encouragement or maybe advice that you would want to leave them with today?
Yeah, I just think staying positive is the most important thing. You've gotten this far, which really says a lot about you as an individual. Most patients are too scared to even start the journey process. So the fact that you even made it this far is incredible, and it shows that you're committed to a change in your body. Just realize that this stuff takes time. And again, the idea is that you're going to have a support system in place through Shed, through your provider, to really guide you through the process. So we're not just going to leave you hanging in the wind per se. The idea is that we're going to slowly taper you off the medication and essentially start you on a plan that may make sure you're set for life. If that's a microdosing, that's one option, or with lifestyle modifications, or perhaps just switching to a different medication, whether that's an oral GLP-1 or perhaps a GLP-1 booster or Revive as a supplement. But don't feel alone. You have a support system in place. Yeah.
Absolutely. Great advice. Thank you so much,
You're
Dr.
very
Niazi,
welcome. Thank you
for
so
the
much, Brittany, for having
podcast
me.
today. I appreciate it so much, and we'll see you soon. Are you concerned about the side effects of a GLP-1 medication? Rightly so. GLP-1 Revive was designed specifically for GLP-1 medication users to help minimize those side effects like nausea, bloating, fatigue, and digestive discomfort, so you can stay focused on your weight loss and health goals. Feel your absolute best on your journey with 10% off GLP-1 Revive today using code POD10, POD10.